As a follow-up on the recent 16 Days of Activism campaign, UNAIDS is joining a coalition of civil society organizations to strengthen and sustain the campaign against gender-based violence in Namibia by holding events on the 25th of every month, also known as Orange Day. Gender-based violence is a severe human rights violation and constitutes one of the most widespread and harmful displays of gender inequality globally. It has been estimated that 1/3 of Namibian women have experienced physical or sexual abuse at the hands of a partner. Recent research has established a clear association between intimate partner violence and HIV and AIDS.
There's a number of reasons why women are more at risk of acquiring HIV and more at risk of actually being victims of gender-based violence. For one thing, women can face barriers to accessing HIV treatment, care, and support services for a number of reasons, such as limited sexual decision-making power, lack of control over financial resources. They may be dependent on their partners. There's also issues in terms of restricted mobility. They may not have access to even go to the health centers, and they also have caregiving responsibilities. So those are some initial factors why they may be having troubles to get their services. In addition, if women are facing violence, then they even have more fears in terms of accessing services. So especially women who are living with HIV, they may not want to disclose their status because they're feared that they'll be abused.
The hosting of Orange Day by UNAIDS on the 25th of every month wishes to emphasize the need for greater unity among stakeholders and partners to create more effective and sustained actions in the fight against gender-based violence.
Orange Day was proclaimed by the UN Secretary General's campaign to end violence against women and girls as a day to demonstrate our commitment to the fight against gender-based violence.
The session today was seen as a moment to take stock of the progress made in the fight against GBV, assess gaps, challenges, and engaging actively in calling for future development frameworks and strategies to address the crisis at hand. Reporting for the News on One, I'm Brumalda English.